Hello, everyone. Good morning, afternoon, and evening. My name is Hema. I am a Senior Director of Product at Google, and I'm also a Board Co-Vice Chair of the Bay Area Global Health Alliance. It is my pleasure to be in this forum at the Global Digital Health and honored to host this panel specifically on this really important topic, strengthening the role of social media in advancing global health. Very little, short, brief introductions about the Bay Area Global Health Alliance. We are a multidisciplinary global health community with more than 70 member organizations that includes academic institutions, NGOs, and nonprofits, and other private sector companies. We're based in the Bay Area and around the globe, and our mission is to work together and build connections across the sectors to accelerate collective impact in advancing global health equity and innovation. Let me start with introducing the panel now. We have a stellar panel today. I'm going to start with Gladys Mugambi, who's the head of public promotion from the Kenyan Ministry of Health. We're going to hear from Gladys through a video today. She has a passion and background in food and nutrition and serves as a scaling up nutrition focal point in country, as well as she is the co-chair of the SUN Executive Committee. She's pursuing her doctorate in health systems management. Next up, we have Andy Patterson from the World Health Assembly. Andy is a team lead for digital health channels in the Department of Digital Health and Innovation at the WHO. At WHO, Andy strives to amplify vital public health messages to more people through more channels. During the COVID-19 emergency, Andy has engaged the digital sector to support this mission and leads a task force of over 60 companies working to tackle misinformation, raise quality content, and develop new digital channels. Andy has also been the web lead for over 35 emergencies and while at WHO with deployments to the Africa region to support both Ebola and cholera outbreaks. I'll say this off script. Andy is also a really good friend and a wonderful human being and really brings levity and laughter to an otherwise somber situation every single time. Andy, thank you for everything that you do. Next up, it's my pleasure to introduce Erin Nilan, who's a global lead for consumer and patient program innovation at Johnson & Johnson. Erin, in this role, she works across internal teams and with external public and private sector partners to improve patient reach in low and middle income countries, ultimately getting more people to the care they need. She joined Johnson & Johnson in 2016 and has held numerous marketing leadership roles across the business. Prior to J&J, Erin worked in global public health across Africa, Asia, and North America for nearly 15 years. From early in her career, as a registered dietitian providing clinical patient care to her current role, Erin is a fierce advocate for improving personal health and advancing health equity. Welcome, Erin. And finally, it's my pleasure to introduce Christine Odor. Christine is a Global Senior Program Manager for Digital Health at Population Services International. She happily refers to herself as the voice of the digital consumer, working closely with the Insights team across PSI to meet all business and consumer needs in the digital experience. Christine has over 12 years of experience in project management and social and market research in public health. She has a background in population studies and a bachelor's in education from the University of Nairobi. And she's joining us today from Nairobi too. Welcome to this panel. With this, we're going to start with a video from Gladys, and then we're going to have a rich panel discussion with this group.
Yeah, I'm Gladys Mugambi. I'm the head division of health promotion, Ministry of Health in Kenya. The division of health promotion is responsible for health communication, conducting advocacy, communication, mobilizing communities, And at national level, our role is to build the systems so that the counties can be able to provide the health promotion services as required. We also develop guidelines and policies and strategies, but in times of pandemics, we take a big role in ensuring that we communicate on the situation concerning any pandemic that may occur. The ministry has actually improved in terms of using social media. The ministry has a website, and we also have social media handles that we use, Facebook, Twitter, and we also have in health promotion, Facebook that we use to communicate on various matters. So the ministry has been improving and trying to bring on board people who can help in making sure we use social media, because we can't avoid it. That is the way to go now. We are moving from the traditional way of communicating to making sure people get information faster. In the recent past, especially during the pandemic, we were able to work with our partners to enhance our communication through social media. So the biggest thing I'll talk about is the partnerships, getting together several people and partners who can be able to pass this message through their social media, because in social media we need to have networks. So we've created those networks, and also having our officers trained so that they are able to do that work. We've also had the communication team in the Ministry of Health supporting in making sure the messages are going out and they are responded to. In the use of social media, we of course need people who have the technical knowledge. At the beginning, we had a challenge. We needed to be updated, so we had to have officers being trained. And we've also had a challenge in terms of people not knowing our social media and using it. That is as a trusted source. So we had to create awareness on that so that people could know what information is coming and where it's coming from. And also, as I've said, the technical support which was required, which has come from our partners like PSK and PSI. They have been able to train us and also provide the resources required. As we build our systems for communication, social media is coming up as one of the most important ones that we must use, especially knowing that most of the population are now using social media daily. It is the best way to communicate. So what we intend to do is ensure that all the social media channels are used by the ministry, making sure that they are functional and there are people behind it so that we are able to provide the right information and also do it the right way. So as we move forward, we'll be launching our social media again, relaunching to ensure that people know where to get the information and so that they can use them.
Thank you, Gladys. As this forum recalls, Gladys is the head of health promotion at the Ministry of Health in Kenya. A few takeaways from her quick video. Something that she said a few times: social media is an important part of daily health messaging because that's where people are. I was also struck by the fact that it is a very disciplined attempt at making sure that you have the right message, trained staff, and building out a proper social media network on behalf of the health ministry. Great insights in there. With that, I'm going to actually turn to Andy. Andy, from a World Health Organization's perspective, what have you seen? What has been the impact with an increase in usage of social media during the pandemic and some lessons learned from there.
Thank you, Emma, and thank you for the generous introduction that you gave me earlier. I'm humbled to be here on this excellent panel today. So my job is to get more health messages to more people through more channels, and we do that so that they can make better health decisions and ultimately, and this is important, live healthier lives. Social media is definitely a game changer. Obviously, I don't need to tell this panel this, but when we consider that more than 60% of the population of the world are on social media, and that of those people, that's not just digital, obviously, that's just social media. We are on more than 6 different social media platforms each on average. So it's a huge and extraordinary opportunity for the World Health Organization to literally reach people in the palm of their hands, in their own language, in their own voice, from their own influencers, to get these health messages into their lives and so that they can make better health decisions. What we try and do at the World Health Organization is get our messages, our guidance, and our recommendations into people's digital journeys. So rather than drag them into our channels, we try and get our content into people's digital lives. We still talk about health as digital health, but actually it should be health. We don't talk about banking as digital banking, yet we're all doing it online these days. So what we have to go is get to that place where we're all talking about health in the same way as we are with banking, which is to say, these are digital health. It's just the normal way we do things now. For WHO during the pandemic, we work on 3 different pillars. The first is to raise good content. We do that, and that means WHO content, other UN agencies, strategic partners, as well as Ministry of Health in content into people's lives. We work exclusively in my team with the tech industry to make sure that these trusted sources of health information are being elevated to populations. And we do that mostly through social media platforms. We also try to make sure that we promote good and authoritative news sources into these people's spaces and lives, so that they're not just getting anybody who calls themselves news, but people who make sure to fact check their stories and use this. But of course, as we'll see throughout this discussion, the explosion of social media and the speed at which news travels across social media is actually a double-edged sword. With all the advantages that it brings, there is many disadvantages as well that comes along with such an important and powerful tool. So from our point of view, during the pandemic, it's definitely been a game changer. It's definitely saved millions of people's lives, and we've definitely moved fast and quickly to get people the quickest possible and best possible health information to keep themselves and their families and their friends safe during the pandemic. What we're doing for COVID, and since the question was specifically about the pandemic, I do want to emphasize that everything we've learned through COVID, we are now moving into a new way of doing business on all kinds of health topics. We have to see COVID as a point of change, a point of inflection in the way that we communicate with large populations. And so in the future, what we're doing is we're creating over 300 health topics, which we will get out over social media in the same way that we've been able to approach the pandemic. Back to you, Hema.
Thank you, Andy. Those are some sage words that let's actually see COVID-19 as a point of change and as an inflection, and in further using technology as a force for good. For this panel and for our audience, it is with a lot of gratitude to Andy and to WHO for your partnership with Google and YouTube in bringing authoritative content across hundreds of countries practically and getting to billions of people. Now turning over to the private sector for a moment. Erin, can I look to you and say, how does Johnson & Johnson think of social media? What are some of the best practices in the usage of social media in your working with nonprofit and government entities?
Yeah, great question. So Johnson & Johnson is the world's largest healthcare company. So obviously we're all about and very driven to improve the health of more people in more places around the world. And as Andy so rightfully mentioned, the use of digital, including social media and other platforms, is a game changer in being able to reach more people and get more people to care. I have the honor and privilege of working within Johnson & Johnson's dedicated global public health team. We are an organization of people within J&J that's working from the lab to the last mile to bring our innovations and capabilities from the J&J business into global public health, working to improve affordability and access to care. And so to best do this, we're using as many of the different channels that are available to us, and digital has been pivotal in that, and being able to work with partners across global public health to maximize and optimize the way that we're using those channels. Pulling on what Andy was talking about with the COVID-19 pandemic, one of the core things that we were doing, working in partnership with teams from PSI and Meta and many others, is to really increase vaccine confidence and uptake over the past few years. So as you think about that application and how J&J as a private sector partner can bring our learnings and our best practices in social media into this space, when you think about digital, it really is another channel, another way to reach people. And so being able to do that, you need to be able to craft the right messages and to be able to understand how to actually reach people with the right message at the right time through the right channel. And so one thing that we've been able to bring to our partners in the space is in-depth insights research that then helped us to identify 5 different behavioral and attitudinal segments within COVID-19, from vaccine enthusiasts through to skeptics, and then be able to define key messages that would help to drive confidence in getting vaccinated and drive that behavior change, understanding the different target audiences and their core insights. Then developing creative that we shared with partners, and then taking an interesting data science approach with partners like Frame, so that we could actually understand where to find those various segments of the population in order to target them with the right message at the right time through their preferred channel. So be that Facebook or Twitter, key websites, as Andy mentioned rightfully, it's not just about digital news or digital banking or any digital, it's just news, right? So how can you reach people through news channels that are also digital platforms, being able to provide those capabilities to our partners. One concrete example of how that came to life was in partnership with PSI and with Meta in digital campaigns that were done across Southern Africa and in West Africa to be able to get critical messaging about the impact of getting vaccinated, serving up critical information to help drive people to vaccination campaigns and help them get the vaccines that they need in order to protect not only themselves, but their loved ones and their communities throughout the pandemic. So that was a really helpful means of being able to bring core capabilities from the private sector to be able to understand audiences and be able to then find them through these different digital channels.
Thank you, Erin. That was so the 2 really powerful insights that I took away as you were sharing the examples. One is the understanding your key audiences and then tailoring the very specific messages to depending on where they are on the vaccine confidence spectrum. And the second thing that matches to what Andy was talking to, meeting people where they are. So being a part of their journey and showing up in their regular pathways in ways that are understandable. That is fascinating. That brings us to Christine, who I think, Erin, you mentioned also that you had multiple partnerships with PSI. Christine, from your point of view, in what way has PSI used social media since the pandemic started?
Thanks, Emma. As Erin and Andy have mentioned, the shift and innovative use of social media has grown in the last 2-3 years since the pandemic hit. Just because most of the audiences have shifted to that space to get more information, PSI has been running social media PSI has been running social behavior change campaigns online for over 8 years, really, focusing on areas such as malaria prevention and case management, HIV prevention, contraception, and sexual and reproductive health. In the past 2 years, however, PSI, in partnership with Meta, has been running social behavior change campaigns for COVID-19 prevention and vaccine uptake in over 26 countries globally. We've been able to reach 300 million people with health messages. The difference, however, in the last 2 years is the scale and the best practice we have been able to bring to these campaigns. 3 years of learning, of course, from the 8 years that I mentioned, and capacity strengthening efforts with Meta and strategic partnerships with other implementing partners like Johnson & Johnson to design our campaigns that are more relevant and engaging to our target audiences. These collaborations and strategic partnerships, we have enabled us to use a lot of data, or have access to more data to inform our campaign designs, from social listening data to resources like Meta's Data for Good. And for instance, in Kenya, I'm going to just reference what Erin mentioned. We have been able to leverage on the Frame platform to better target our social media campaigns based on reasons for COVID-19 vaccine hesitancy by age, gender, and location. PSI is also using social media to design messages locally with consumers in a bid to move away from ascribing same rules from traditional media to social media. We are working with smaller organizations like AIfluence to design messages in areas like sexual reproductive health to communicate quickly and in ways people do naturally. This strategy is supporting us to get quicker insights, generate and adapt content aligned to what our target audiences can connect with. So ideally what we're doing is we're trying to keep the social part of social media through this strategy. Where possible, PSI, in direct collaboration with governments, and I think Gladys earlier through her video also mentioned that level of collaboration in Kenya, for instance, with an effort of aligning to national health communication objectives, we are using social media to expand the reach of existing resources. A quick example in Kenya, for instance, is the use or the ability to use social media by embedding linkage support digital tools in our social media campaign materials to support the ministry with increasing access to COVID vaccinations by mapping, all facilities that are validated and approved by the ministries of health to issue COVID vaccines. So that is just in support of the gap that has been seen from people who would like to access but do not have information on where to access health services. And that is not only limited to Kenya. We are doing the same in Nigeria and Uganda. And we are also leveraging on the same tool to support, linkage to health services in countries like Uganda, especially at the beginning of the pandemic, when audiences were a little, sensitive about visiting facilities and needed to know information where to get sexual reproductive health services, for instance, during the pandemic. So we are able to map them to facilities that offer quality services through the use of social media. The other area that we have used social media as PSI is by supporting in answering questions that keep coming up from our target audiences on different issues around public health. So we are leveraging on, trusted communicators and going through some innovative approaches and aligning to where our audiences already are. So for example, we are using, live sessions with the help of health providers to support answering some questions on COVID, questions on, sexual reproductive health, HIV, STIs, and engaging them more effectively or in person in a manner that they're able to connect and get some of those questions answered. And that is, I'd say, also really closely linked to what our role has been in supporting, the shift from misinformation, or helping our audiences align to what the right information is. We have seen a lot of misinformation on social media, specifically on COVID, because of how fast and how rapid things have changed, either from vaccines themselves or, from other pieces of information that need support with data and all that stuff. So we are making sure that we are having strategic partnerships that is enabling us access to valid information and people who are seen and trusted by our target audiences to engage them more innovatively through these spaces. Lastly, in the interest of time, I could just also mention that PSI is leveraging heavily on the use of, social media to inform the quality of content that we push out there through the use of A/B tests. And we are working very closely with other partners to ensure that the content that is designed, we are taking advantage and developing some content online, like I had mentioned earlier, but we are making sure that the content that is designed and pushed out there is the right content to our audiences. And the A/B tests are able to enable us select what resonates more and where we get more engagement that we are able to leverage on. Back to you, Emma.
Andy, maybe you can share some of the examples too?
Yeah, I loved what Christine said, and I want to pick up on 2 points which I think are really pertinent. The first is that digital tools can really help in ministries of health and healthcare providers fill the gap of the lack of healthcare workers there are in the world. Everyone knows we don't have enough doctors, nurses, and midwives. And so if we can have digital tools which take some of the pressure off them to allow them to only see the patients that they need to see, rather than also becoming a source of information, this is a massive win at the point of care when it comes to working with populations, especially vulnerable populations. A couple of weeks ago, I was in South Africa, and in a township in Cape Town called Khayelitsha, and they have a chatbot which helps young mums and expectant mums deal with their pregnancy and up to the second year of their birth. And I thought, what an incredible project. These 6 or 7 nurses and midwives who run this service can talk to literally tens of thousands of people through an automated chatbot, plus, when necessary, jump in to do interventions. If just looking at the number of people they can service with this bot was incredible compared to what they would have been able to do in a health clinic. So that was my first point, is we can't underestimate the power of technology and the power of social media to allow people to get the information that they need when they need it most. The second thing that I love very much about both the last 2 people spoke was about testing messages and getting the right message out to the right populations at the right time. I think it's a duty when we work in public health to think about the projects we've run, especially over the last 3 years, and to start documenting them properly. Let's get out there. Let's start doing case studies. Let's join forces with academia, ministries of health, and tech companies, and come out what is the best practice when it comes to reaching populations, which words, which communication messages are going to engage more people at that time when you need it most. And I think that's something that we have a duty of. And certainly in my team, having been through the pandemic and sitting there day on day, grasping opportunities and getting health messages out, research and case studies was at the back of our mind. We now have to sit back, take a deep breath, and start documenting all this for the good of public health.
Thank you, Andy. Before I go on to the next question, I just wanted to say, Christine, I think the way that you described the practical applications is fundamentally inspiring. It is not a lot of hand-wavy theoretical talk, but it is like real clear examples of connecting people with facilities when it comes to tough topics or topics that people are not comfortable with. Live Q&A with practitioners, super inspiring. The 2 things that I took away from your response an ecosystem approach, so use the entire set of participants in an interesting way. Two is strengthen capacity, especially, and Andy, this is to your point, when you have a limited staff, how do you actually strengthen and expand the capacity with the current set of, I would say, resourcing that you have, but using technology as a platform. Thank you, Christy. That was phenomenal. Now, moving on to probably a little bit tougher area of conversation with this panel. Andy, I'm going to look to you again. What challenges have you seen from the rapid scale up in the use of social media, and what's the role that WHO is playing in addressing these challenges?
It's a really good question, and I'm probably going to state the obvious to start with, and forgive me for that, but I wouldn't do my job if I didn't state the obvious to start with. Obviously, social media is an incredibly quick way to get content into people's lives, and unfortunately, this also means that misinformation can spread quicker, and I've seen somewhere that it spreads something like 6 or 10 times faster than credible content, and it goes deeper to further reaches of social media. So from my point of view, the spread of misinformation has been one of the biggest challenges, which has, let's face it, cost people their lives. 100% sure that has happened. So it's a double-edged sword. It takes 30 seconds to a minute to upload some junk based on misinformation or thought processes or something you've read in the press or misinterpretation of data. But sometimes it takes weeks for the science to catch up and create a credible science message and then put it out. And unfortunately, most people who work in public health are scientists who deal with science and maybe not the communications and the PR side that a lot of the misinformation and the anti-vax community, or as I like to call them, my own personal thoughts, pro-plaguers. It's so much harder to create a science-based video and get it out there and for it to be good and engaging. When I was growing up, I knew a credible source of information, and that would be, journalistic sources like BBC, Al Jazeera, CNN, the New York Times. All of these places in my mind were credible sources of information. But if you look at younger generations and they compare what they have to see now, you have creators who have 25 million followers creating really fun, engaging, powerful, with music and huge emotion. With misinformation in it, where the content is not what is actually engaging, it's the way it's presented. They say a good social media post has something changing every 4 seconds, a frame change, a word appearing. That's too much for most people who work in public health. We do a lot of talking heads or a lot of animations to spread out the science. And what the younger generation are swiping through that very quickly. So I think that's one of the biggest challenges that we face is certainly the rapid spread of misinformation. So what can WHO and what do we do about it? Well, first of all, we convene the right actors. Our job is a convening power, and also, to provide guidance and recommendations to people. So, with regards to what we've done is we convened the Tech Task Force. I think this is the first time this has ever been done in public health. Already back in February 2020, was sitting in the Bay Area with 40 plus companies in a room at the Meta offices talking about, COVID is coming. We have to tackle misinformation on social media. What can we do as a community of, technology professionals to fight this? And that's when the Tech Task Force started. We meet every month, and we have 60 plus companies now in this task force. What we do is we paint what is top of mind for WHO, and then we encourage the tech sector to come on board and find solutions to those problems, right? So we work very closely with the Bay Area Global Health Alliance, who are key partners in this. We're a member of that alliance. A little bit of shout out to that team who are doing an incredible job. We use them to convene these meetings and help us bring what is the top of public mind to this space. We also provide guidance to social media companies on identifying credible sources of health information. Because as I said just a minute ago, a really impactful video with cool music, which is getting lots of views and going viral, doesn't mean it's credible information that's in there. Gary from the gym may not be the best source of advice when it comes to vaccination protocols and the use of supplements and healthy living to stave off COVID, for example. Gary from the gym is a real person in my life, by the way. So what we try and do is provide those guidance to help social media find what are credible sources of information, identify them, and then help them promote their content over others. We also work with social media companies to fight misinformation, whether it's a single post. And we work a lot with the policy, trust, and safety teams and social media companies. I mean, when I say a lot, it's literally every week since February 2020. We're on the call with the big players, TikTok, YouTube, Meta, which includes all of their brands, and also Kaishu, which is a Chinese social media company outside of China. It's a huge following in Malaysia, Brazil, and countries like that. So our role there is a convening power and is to help them make better decisions when it comes to their policies and standards. And this is something that WHO does across digital. We have standards for interoperability that we use. We're promoting the FIRE standards so that digital innovations can all talk to each other. Have we been successful? Yeah, I think we have. I think I can give you two examples of this. Is when we have we look at the chatbots. 50% of the chatbots that came out at WHO in Arabic came from one country, and that was Yemen, because they have no health services. So we were able to use technology to reach people. Final quick point, the power of partnerships, huge key to solving some of these problems. WHO might have the content, we don't have the reach. We need to work with partners like Johnson & Johnson with regards to getting content out and getting the right content on vaccinations out to the right people at the right time. And we need to work with ministries of health and digital companies, and in fact, influencers, to get them the content to make it more interesting, let's call it sexier, and more consumable and digestible. Back to you, Emma.
Thank you, Andy. Christine, can you build on Andy's comments here with respect to the challenges and how WHO has kind of like become a convening power and figuring out how to create engaging content? How have you seen the key challenges over the last couple of years, and what opportunities do you see to address these?
Thanks, Emma. I was listening to Andy speak, and I could relate to a lot of the points that he was putting across. I'll maybe start from regulation and social media control that we have experienced across various markets where PSI is implementing, where we saw during the pandemic the need to rapidly engage. There was no time to have, back forth and manage all these regulatory issues that are put in place across different departments and governments in the markets where we have been implementing. Our opportunity is to engage and build capacities of ministries and to bring everybody on board. Andy has talked about this being, partnerships and building a community. And PSI is looking at bringing people together, where we can connect, get access to information that then informs how best we can still safeguard our audiences as we engage on social media. We have seen in countries where, while we are in close proximity with a health promotion unit, there is communication regulatory authorities that are a separate entity from health promotion, where we have to figure out a way in which we understand who the players are and to all come in the same space and make sure that the left speaks to the right and create an environment where we are able to rapidly, create speed to markets and just hit the ground rolling when there's need for us to urgently communicate and address some of the issues. The other area where we have experienced a challenge is on measurements. As you know, social media is a brilliant space to reach audiences at scale. And we have been able to, have heavy engagements and reach rapidly, quite a big population. But our ability to get insights around impact, most of the outcomes or health outcomes are outside of the social media space. So we want to make sure that we are not just measuring process outcomes or process indicators, where we are happily talking about, high reach, high impressions and all that stuff, but we are not able to link offline outcomes or health behaviors outside of that space. For example, we had talked about, linkage support services. Are they able to get information that is then enabling them to go and actually take up services or health products like we are hoping the social behavior change campaign is talking about? Are there other ways we can collaboratively come together as a community and start figuring out how we can adequately and effectively measure the outcomes of all the efforts that are put in the social media space? The other bit is, the use of social media messaging applications for health security. Andy had mentioned earlier that social media tools provide an alternative to supporting health workforce with reducing just the workload by providing spaces. PSI is giving, developing chatbots through Messenger and WhatsApp, where majority of our target audiences are communicating on social matters up and beyond health. We are leveraging on those spaces, and we are able to address issues around safety and security. We want to make sure that clients are not as exposed in the event of heavy engagement in the social media space. So the ability for us to, just shift conversations from social media into a more private space that is a little more safeguarded and better moderated, where they can openly share information or linkage to live agents outside of that social media space, where they may need to have conversations on more private and personal information on their health journey outside of a public space. The other thing that I can mention on as an opportunity based on what we've talked about, and it is something that PSI is strongly pushing for and advocating for in partnership with Meta already and other implementing partners, is capacity strengthening. Many ministries of health are beginning to see the potential of investing in social media campaigns and digital tools to reach consumers at scale for health communication. So bringing the ministries closer, building their capacity, and just creating a community where we can address some of these issues will be very helpful.
Thank you, Christine. On the note of building communities, Andy, a quick call out to you. How can local digital solutions, how can local digital communities be part of the global response? How do you see this?
Well, I think they play a vital role, right? I think whatever WHO's role with regards to providing global guidance, or maybe, best of breed messaging standards, or, chatbot workflows or anything like that, I think it's the local health authority at the point of care, which are actually the ones which know their audiences best and understand the needs, the volume, the voice, the intonation, what's necessary. So they play a huge role. And I think that if one of the roles that they could play to make a bigger impact on a global level, even as a local health provider, would be, again, back to my point before about research and case studies, is to actually publish what their findings are so that everyone can benefit. I think the other thing is to think always about a secondary audience that you may have. I can never, in my last 3 years, in the middle of the pandemic, I've noticed, this was the best of times. It was the worst of times, right? It was the worst of times because of the impact on humanity and the loss of life. And there's so many people who are suffering from long COVID. But for me, also, the humanity which came out of it, the innovation, the scalability, and everything that we did was incredible and amazing. So I just want to underline the power of the individual. And I think that people often underestimate what they can do. And they think, I'm just a local authority. But if we take the case of the WhatsApp chatbot I mentioned earlier in South Africa, imagine just taking that and putting it into Uganda, or taking that and putting it into Thailand, into remote islands across the Philippines peninsulas. This is where the power of the individual can never be underestimated. If we can actually start documenting it and producing case studies, those people could easily provide guidance and help for other local health authorities to do that. So from my point of view, it's really about the two levels of partnership, the 3 levels, WHO sort of playbooks, exemplars of what could be done and based on evidence, what works. but also the second tier of partnerships with people, with technology companies to allow that, and then the power of the individual and the local authorities to really actually deliver that point of service when it comes to that. We totally acknowledge that people know their audiences far better than we do. We paint with a broad brush, and we have to. But I think that that's another message with regards to communications. We have to come right back down. We have to stop painting with a broad brush. We have to start thinking of the target audience. Let's say we're trying to reach young gamers who live stream on Twitch who are females. That is a different message than the normal broad brush that WHO would do. So I think technology can also play a part in identifying key audiences and making sure that we understand exactly where they are, when they are, how much they interact with content, and get that content into their digital journeys. So for me, they play an absolutely vital role. But in every case, we can always do better. Back to you, Emma.
Thank you, Andy. Let's actually bring in Erin. Erin, as you look at the role of J&J, how might J&J support the development of a community of practice?
Yes, I absolutely love what Christine and Andy are both saying on the importance of communities and the individual level to influence, but also to be sharing some of these best practices. There's so many great innovative tools and resources that are being developed in the digital space, and being able to transfer that knowledge or the technology across countries and teams, even disease states. We've learned so much through COVID. How can we bring that into HIV and TB and other places? And one great way of doing that is with a community of practice, being able to bring not just best practices or tools that are already created, but also being able to transfer competencies and do capacity building, as Christine was so eloquently speaking to earlier. One way that J&J has been able to do that is through programs, including one that's that we're doing right now with the Sabin Vaccine Institute and their Boost community of practice. Being able to work individually with teams to coach them on how to, as Andy was again bringing up, understand those core insights. If you just say we want to reach 60 plus men, well, a Prince Charles versus an Ozzy Osbourne, those are two completely different target audiences, right? And so how can you dive deeper and understand how can you use these digital platforms? And so helping to improve the capacity and knowledge and really optimize the already incredible work that these different teams are doing around the world to address the needs and improve the health of people around the world. Another thing I wanted to pull on too, that Andy brought up, was influencers, and how we've seen this challenge of misinformation proliferating as you have influencers with large followings creating really engaging content that does not have the science that we would want behind it. And so another thing I think is really important to pull from the private sector is how we are using tools like digital platforms, but also those that are really adept at using them, such as influencers, not just large scale influencers, but also micro influencers and nano influencers who have smaller followings that are more likely to know them personally. How can you leverage them as advocates to help get the information out and increase the advocacy? So as you're engaging with your community, how can you emotionally appeal to them to then continue to share with their community, and so on and so forth? And so then you create this really beautiful digital community of people that are sharing important information and facts, leveraging this technology. And so those different ways I think are really important. One last thing to pull on from what Christine was saying, there's definitely a challenge as we shift from offline to online in being able to measure impact, right? And so one thing that J&J is working on and excited to bring to the space is also how do we get creative with some different tools to be able to move from understanding reach to willingness through to impact. So really being able to pull through the funnel, so to speak, and understand, okay, if we reach somebody with this message, how did that impact their attitude and ultimately their behavior? Did they engage in the health behavior that we wanted them to? And so that is an emerging space that we're really excited to be working and partnering with others, including some on the call with that.
Thank you, Erin. It's only 7 a.m. for me, so I can go all day long chatting with all of you. But I think our audience and this forum have a bunch of additional sessions to also attend to. So I'm going to ask everybody in one sentence, what are you excited about with social media and innovation? Christine, what are you most excited about in the space?
How fast that space is changing, the ability for us to catch up, and we need to be in the same space, work as a team, as a community to figure out how we can catch up with the changes.
You have an unbelievable energy, Christine, in creating bias for action. Really. Erin, what are you excited about?
The creativity, those that are engaging in the space at an individual through to a community level. I think there is so much untapped creativity still that's going to just help us all to continue to innovate in this space, whether we're tech partners, private sector, public sector, WHO, all of us working together and including those that are on the platforms, bringing that creativity to bear. I think there's just so much greatness still to be unleashed.
Ecosystem creativity. Love that. Andy, bring us home.
Well, for me, both of those were on my top 3 list. For me, it's also the innovation of technology, which will be able to identify people and answer questions that they don't even know they have to ask about their own health. Like today, it's telling me that it's sunny outside. I can see it's sunny. I've never asked if it was sunny, but my technology is telling me it's sunny. That's great, but it should be telling me about my health. It should be, reminding me to wear a motorbike helmet when I go out on a motorbike. It should be reminding me as a middle-aged man to do a bunch of tests I've never done before as a man. And I think that this technology that could prompt, because technology and social media know more about us than we know about ourselves. And the other day, I shared one link about handbags with a colleague, and now all I get is adverts about handbags. They know me very well. I wish they could put this this power of technology to better use and bring me health information that I don't even know that I need to know yet. Back to you, Hannah. Thank
you, Andy. Personalized and proactive health. This has been a really, really fun panel and a very insightful one. Christine, Erin, Andy, and Gladys at the top. Thank you very much for being here, for sharing your thoughts, and I hope both the conversations and the collaborations continue. For the audience, thank you for your time. I hope you all have a fantastic day ahead, and wishing you all a quiet and a fun-filled December and holidays with your family. Cheers, everyone. Bye-bye.